did Michael Emerson sneak in? No, okay. So those, if he sneaks in, I'll introduce him. But those two folks are here, and that's your those are 2 of 5 of your board members for the Grossmont Healthcare District. Those are the elected folks, and they are the ones that actually make the funding decisions. All right, we do have a grants committee. 2 folks sit on the grants committee. Right now, it's neither one of them, but it's important because 2 folks see it and make a recommendation, and then it goes to the other 3, and 2 of the other 3 are sitting here. You will. I don't want to get into too many weeds, but it's kind of interesting because if you came up to them today, afterwards and said, I'd like to contact you at some point. State law now, new legislation that was passed last year. The state law says that elected board members cannot meet with any of you outside of technical expertise or whatever it may be. We've got a committee process in which we do that. Why the state law goes so far in doing that, I'm not sure, because I really don't understand why an elected official shouldn't be able to choose to meet with someone if they wanted, as long as they didn't make a commitment before hearing all the information in a public hearing. But that's what the state legislation says. And so if you see that in our policy, which you do, in our grant application, that kind of gives you some background on why. We're not just being ogres and trying to keep the elected officials away from you. We're trying to keep them out of prison, okay? So, thank you. And that's what, I guess that's why I get paid the money I do, so I keep them out of prison. All right, so, anyway, we will dig right into it. Last year, how many folks were here last year? Okay. Great. If you are here, I hope no one's here because they think, I gotta go or they're not gonna keep me. Okay, that's really not what this is about. There's certainly no obligation for anybody to attend, and we're not checking a box saying they attended our grants workshop or not. We don't even look at that. We're just trying to be helpful. I think last year we had a lot of folks that had never received grant monies from us. Maybe those that had applied but hadn't been successful, and some of those came back after the grants workshop last year and then were successful. And so we're just trying to be helpful. And so if you have been successful with us in the past and you figure you know what you're doing, there was no obligation for you to attend, but maybe you can see how you can better your application moving forward, and that's what we'll try to do. So, boy, Bob was telling me it's blurry when you sit in the back. I just turned around, it's blurry right here. It's really, and I'm right here, and I got it. Okay, everyone's holding it though, right?
Is there anyone that didn't get a paper copy that wants one? Okay, base is covered.
Okay, so try to follow along on your paper copy if you can't see that. Okay, and so much of this looks like our policy has in the past. We will delve a little bit into the major change, and Erica is going to handle that. But the beginning is just kind of talking about how much money we've given, since 1996, and it's over 52. It's certainly over 52. I think we probably need to update it, and it's probably more like 56 now. But that's definitely over 52. And we've been doing it since 96. And as you probably know, those monies are now limited to nonprofit organizations. We emphasize healthcare, obviously, and to the extent we can, direct patient care, and then government agencies. But government agencies we have limited in more recent years, probably close to 7 or 8 years now, to those that are educating the future healthcare workforce. So that means like Grossmont College and programs like that where they've got cardiovascular tech and things like that. Part of that is, we're a government agency, and if another government agency doesn't have money, are we just okay? Well, we're supplementing their money. You understand that. But so it really comes down to nonprofit healthcare organizations as much as possible. The big one is that really kind of big paragraph right in the middle of the page. This is the big change. And Erica's going to take this in a little bit, but we've over the years moved more and more toward what are the actual needs in the community that have been identified through And there's folks that do that. County of San Diego does that through Health and Human Services. Hospital Association of San Diego and Priego Counties does one. Sharp Healthcare, which is our partner at Grossmont Hospital, does a needs assessment. And so in the past, our grants policy has spoken to the fact that if you apply and are meeting one of those needs, you will be looked at more favorably. We've now made it, no, we're taking 500,000 of this money that we're putting out there, and we're telling you that you apply for that or not. And Erica's gonna get into that. So that's the major change in this policy this year. And you can see those are the prioritized needs that have been identified in those needs assessments I mentioned. And so we're not gonna throw the application up here. The email we sent you all has our resource page, as Erica mentioned. You can click on that, you can get the application right there. And that application shows where you check the box or not when you're filling out that application, that you're applying for some of that $500,000 because you're addressing one of these needs, or maybe more than one of these needs, and you're checking the box on that application, and then the narrative speaks to it. So I'll leave it at that, and Erica can delve in a little bit more. So, moving down, if you can.
Yeah, absolutely, so.
Just pull it up, so. Is it blurry to everyone, or is it just me?
Yes, it's blurry.
Okay, but look at your page. So we're still on page 1.
Right.
Some of this is just, we never know when the state's gonna do something to us, so we're just letting you know that, hey, if the state changes something, the way we do it, we have no choice, and so we can amend this policy as needed. This year, we've got 2.4 million. That went up a little bit from 2.3. The reason for that, I'll show you.
Do you want me to talk a little bit about how we got those needs?
You wanna do it now? Perfect, do it now.
Why not?
Okay.
So, whether or not I see a large show of hands or not, either way is good news to me, but how many of you are familiar with the fact that we have a regional needs assessment that takes place through the partners? Okay, we're about a 50-50. So some of you may be looking at your papers probably, maybe not the blurry screen, but wondering how did they get these five needs. So the reason that we kind of tie back to our needs assessment process is because all of the hospitals in the region, all of the community partners that are sort of engaged in forums not unlike this are involved in that process, and these issues reemerge every 3 years through this process, this needs assessment process. So there's the planning phase where they're collecting data from people like us. There's the implementation, which is usually year 2 of the 3-year process. That's where they try to kind of implement some of the programming as a response to the data that's coming out. And then we evaluate. That's what we all do, right? We plan, we implement, and we evaluate. And so the Grossmont Healthcare District, both as Sharp's partner in operating the hospital and as a partner in this region, has a responsibility to look at that data and work together as a community to generate a response. Now, we're not transferring our entire grant program in that direction, but we do want to, show the community that this is something we can do together to address these needs. Do they change? Not really. If you were to go back, and we can certainly make these needs assessments available to the people that are in here that think they may fall in one of these buckets, we can get you this information. But for those that are maybe a little less familiar with how things shake out every 3 years, these are really the top needs, especially in the East region. And we have great partners at the hospital and the community organizations that help with that process to speak specifically to this region. You all serve this region, we serve this region. These are the top needs that more or less come out every time. And there are others, but that's where we have flexibility in our programming. So just, here to be a resource just as much as Barry or our board or anyone else if you have questions about that. But anyone that's wondering, how the heck did they find this and where does it come from? There's a lot of data and a lot of effort that go into that. So
Thank you, Eric. So, the next paragraph, I'm not gonna spend a lot of time on it, but just to give you an idea why we take that 2.4 and we dedicate $1 million to benefit the hospital. We've always done that. In fact, just under 50% of that 52 or 56 million, wherever it is right now, it has gone to benefit the hospital over the years. Sharp is operating the hospital, it's still owned by us. And to the extent we give money, we give tax dollars to benefit the hospital so they can do major equipment or whatever it may be, is improving your public asset, essentially. And of course, the important thing on that lease is any improvements made to that hospital, whether by Sharp Healthcare or by us or jointly, when the lease ends, Sharp doesn't take those improvements with them. It's still the public's. So that just kind of speaks to the lease arrangement a little bit and why we dedicate money. The important thing is the last 8 years now, that million, and in 1 year it was actually more than $1 million, that million doesn't go directly to the hospital, it goes to the state of California, and the feds supplement those dollars with matching funds. So your tax dollars are getting doubled. Benefit the hospital to the tune of twice whatever we give them. So it's, most years we've given $1 million and the hospital has seen $2 million, and that has to go to Medi-Cal services. That has to go to actually lack of reimbursement for Sharp providing the significant Medi-Cal services they do, especially in the East region. So I'll leave that there. And go on. Okay, here is really, this graphic looks the same for the scholarship programs. I don't know how many are in here that would fit the mold for scholarship, probably very few of you. But the reason we increased the amount from 2.3 to 2.4 really comes down to this, is because we've increased the amount a little bit for the high school scholarship programs, the BA nursing and the health tech scholarship program. We've increased it a little bit. And then we've created, that fourth one down, we've created a new program. And this is part of what we just identified in the needs assessment. If folks are studying they're in the arena, they're studying, and they're studying a post-baccalaureate degree program because they want to be a behavioral health provider. We're going to provide some nice scholarships for them. So that's $50,000 we never had in this program before. And then the last one there, $21,000 advanced registered nursing scholarship program, and that's for RNs that are working in the East region already. So by the time you add up those ads, it gets to close to 100, and that's why we increased the 2.3 to 2.4 to not diminish the general grant funds that are out there available for general community grants. Okay, so we'll move down. Grants and sponsorships, by the way, that E there before you get to number 2, it used to be we separated these out, from a funding source standpoint. It's the same. Whether you're asking for sponsorship of a charitable event or a grant, it's no different to us from a funding standpoint. The difference is what threshold do you have to be at to apply for a sponsorship. And that sometimes is too high a threshold. No more than 20% of your gross monies can go to putting on the event. And some folks just can't get there because they like to put on really expensive events. No, I will leave that at that. Okay, go on. Let's see.
Keep cruising?
Well, let me see number 4 and 5 there real quick. Obviously, we don't issue an RFP. It's a grant application. You know that. And then I just mentioned this. You can submit for both a grant and sponsorship of a charitable event if you meet that threshold I just mentioned, and it's spelled out later in here under number 13. But if you're going to apply for both, and I don't know what your chances are of getting both. Okay, I don't know. That comes to the committee and the board, right? But if you were going to apply for both, send them to us at the same time, please. We don't want to sit here and you've asked for a grant for 25, and then your event comes along months later and you ask us for $5,000, and we're saying, well, why didn't you tell us? So just ask at the same time. Okay. This is number 6 is an important one, and we've done this now for several years. Even though we can fund starting July 1st, going all the way through June 30th of I hate to say this, but 2020. 2020. Okay, we really wanna know what you're gonna ask us for before December 31st, okay? And that's so when we get to November and December, and especially January, we know how much money we have left, and that we know what is being asked.
And can I add something here?
Yeah.
And also, we are planning on getting all of our grantees together toward the end of January so that we can kind of focus a little more on some of the ways that you can collaborate on information exchange and things like that. So if you want to be a part of that conversation among other grantees for this year, then it would behoove you to get that in early. Never mind the fact that it's first come, first served.
Right. Okay, so, and that's my next key. I'm not telling you to wait till December 28th. That's not what I'm telling you. In fact, when we implemented this 6-month kind of deadline a few years ago, people got it so quickly that all of our applications hit us by essentially July and August, and we were sitting there with a pile. And the money was gone a couple years by the time we even got to October, November. All right? Now that slowed up a little bit as people have gotten accustomed to the fact that, you know, we're not going to, if you submit it in July and we've got 40 applications, I guarantee you the grants committee is not going to review all those 40. We're gonna carve it up over 3 months, okay? But so I don't know what to tell you the best time is, but certainly, you know, I mean, July, August, September, October are probably a good time to apply. Just because that December 31st date is there, I wouldn't recommend waiting for that. Although we may take that long, okay? We may take that long to review them. Anything that hits us after December 31st, we can consider. It depends on available money, and then it requires a 4/5 vote of the board. All right, so that's an even higher threshold. Usually the grants committee usually doesn't recommend those because they didn't meet our deadline, but they still go to the board, and then it comes down to a 4/5 vote. So that's just so you kind of understand. Funding limitations. For larger grants of 25,000 or more, this has been in place for now a long time, and that is you are eligible for no more than 100% of what you asked, of what you received in a prior year, and that means the 2 most recent years. The reason we do that is simply to guard against what we saw as creep over the years. Can you? Can you? Absolutely. If you send us something that's higher than that and you're justifying it because it's a new program, you give us good reasoning why you think you need more, and this spells out in there too how you do that, what you have to do in that regard. You can, but oftentimes that may take away from some other great program we want to do. All right. So that's why we have that 100% in place. If you look at A, B, C, or D, if you were going to ask for more than 100% of what you had to ask, what you got in the past, those are the requirements there. And by the way, that requires a 4/5 vote of the board too, for 100% or more, okay, or more than 100%. All right. Enough on that. Obviously, East Region is important. Go down to 9. Collaboration. Collaboration of like services. We've had this in here a long time. Very seldom have we seen any applications that do that. We're really trying to push that now, especially now that we're focused on the needs assessments and our 500,000 is there. You know, maybe that puts you in a position of, hey, I don't qualify under the 500. Are we saying you can't apply? No. There's other monies there that aren't identified needs assessment thing. But maybe you've been thinking about going in that direction anyway, and maybe you want to collaborate with someone else who does that. Maybe they're sitting in the room. Okay, we can't tell you who to partner with, but we can give you a list of all of our grantees, and you can kind of see who's doing what, and that way, if you want to try to collaborate, you can. My example last year, I believe, was the one that the only one I've ever seen, in which it was a collaboration, was, I see Kay sitting back there, so I'm gonna give some praise to Home of Guiding Hands. So a few years ago, there was we were giving money to another nonprofit that was doing field trips, if you will, with the developmentally disabled, okay? And taking them out and doing stuff that a lot of times they just don't get. And that organization was folding, and Home of Guiding Hands, which you know, I'm sure, I don't have to tell you who they are, they saw that as something they wanted to pick up and do. So they came to us with an application that included both. They were asking for more than what we had given Home of Guiding Hands before. But what we were giving two organizations combined was more than what Home of Guiding Hands was now asking for. So it saved us some money. We didn't like the fact that the other organization went away, but since Home of Guiding Hands was doing the work, maybe there didn't need to be two organizations. And you know, so sometimes we're a little, well, do people like feel, okay, I do it this way and they do it this way, so we can't work together, and we've got our little fiefdoms, and you know, we've got our jobs and we don't want to threaten that. I understand. I'm just kind of, you know, being encouraging to the extent I can. Now, as it turns out, we don't fund that for Home of Guiding Hands anymore, because they've got some mandates in place in which they have to provide a certain level of nursing services in their group homes, and that's what we do. But that was a great example of collaboration. Now, was that because voluntarily they both did it? No, Home of Guiding Hands did it voluntarily. The organization didn't do it voluntarily. They didn't go into business. But we'd like to see some organizations come voluntarily and say, we're going to joint submit a proposal to you to do something and make what we do more efficient.
And depending on where you are in that process of thinking as an agency, that is why we're here to also collaborate with other funders, and really, you know, provide the resources to those of you that want assistance, maybe through examples of others. So we know this is a learning process on both sides. It's another reason we want to get all of our grantees together. And we heard you last year. Those of you that were able to attend last year, you asked for these examples. And we hear you, and we're doing our best to get connected with the right players as well.
And by the way, Jan's sitting back with Home of Guiding Hands too. Sorry. It wasn't just me, sorry. Okay, we'll move on. It gives you some more examples of collaboration there. Increasing capabilities, increasing efficiencies. Read those and take them in. 10, I think we've kind of covered the, you know, it needs to be, if you're outside the East region, it's okay. Your headquarters or whatever it may be, but you need to demonstrate that you are providing services to those who live in the East region, because that's where our tax dollars have to go. Simplified grants, make sure you check that. When you open the application, you will see at the top of the application it spells out if you're asking for a simplified grant, 25,000 or less, or for health, safety, or environmental equipment, okay? You probably don't need to do the entire application. There's 2 or 3 pages you can do in there. Charitable events, I mentioned, this is the criteria for that. Not only that 80-20, that 80%, 20% rule I mentioned, but some other things in there. Don't just send us, you know, a letter, boilerplate that went to all your folks. We want to see in your letter that's specifically to us. It's telling us how it addresses a healthcare benefit in the East region. What you're asking for. Don't make us guess on what your application, what you're asking for as far as a dollar amount, and also give us a menu. If we don't like that dollar amount, show us what your other sponsorship levels are, things like that. Okay, that's all spelled out there. And remember, if you're submitting a grant, you send it at the same time as a grant. I already told you that, all right? So, going down. Oh, you need a budget from last year's event and this year's event, so we can see clearly you meet the 80% rule. And,
am I going too fast?
No, that's fine. I mean, they can read it too, I'm just kind of helping them. Okay. Yeah, golf tournaments. We know folks love golf tournaments, and we understand they're a good source of funding. You know, we're a government agency, sometimes it just comes down to what do things look like? Are we out playing golf, you know? So, that may be good for you, it may not be good for us. So, we don't encourage that. I already mentioned other government agencies, medical equipment, that's a clear one. If we're buying you medical equipment, don't pick it up and move it to San Ysidro or someplace else, we want it in the East region. You've got to agree to our grant agreement. If you want to see that grant agreement, let us know. There's nothing sinister in it or anything like that. And quantifiable and qualifiable outcomes. I mean, you know, we can get into that if you want, but especially when it comes to needs assessments now, if you're applying as a needs assessment, how do you know you qualify? Well, tell us. Give us some data. You know, Erica can delve into that if you want. Go on to 17 and we'll wrap this up. Anybody in the room that really doesn't have a bank account or an organization, any fledgling organizations out there that would need a fiscal agent? Okay, we do allow fiscal agents. That we understand the need for that. We just, I think it says, without me looking, I think it says that we need to know that whoever's acting as your fiscal agent, that was approved by their board of directors. And does anybody want to know the reason we put that in there? We don't want it to be, we don't want your little fledgling organization to be the pet project of someone who happens to be the chair of a board someplace, and they do it, you know, and the board doesn't know anything about it. The board of the fiscal agent is taking some responsibility for being a fiscal agent to an organization. If you've got a nonprofit and then you have a foundation, okay, we understand that sometimes they may do different things. As far as we're concerned, that is the same organization for the sake of funding limitations, all right? And then the last one I already mentioned, we can't meet with you. No, we can provide technical expertise, and that's what this is. Unfortunately, we're restricted outside of our grants committee process to have individual meetings with you, and that's both our staff and our board of directors. Can we have an individual phone call with you? That's technical expertise, yes we can. But we can't go further than that. We can invite you into a committee meeting if we want more information from you, which we will do. That's part of the grants committee process. We can do that. That's that. Would you like me to prompt me on anything that came up last year, or should we just go to Q&A?
You know, I think we've covered a lot of, you know, like I had mentioned earlier, we kind of surveyed those that attended our first workshop last year, and you all gave us some great feedback, and some of it was longer Q&A, so we can start that now, I
Sure.
think, unless anybody wants to.
And by the way, let me do this just qualifier too. Don't ever feel like if you ask some hard question, I'm gonna go, I can't believe they asked that. Their grant application's going in trash. This year, somebody on our board of directors who's newer at this whole grants process kind of looked at our grant application and said, well, why are you stating this twice, and why do you have it in this order, and blah, 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 blah. Fresh eyes sometimes mean something, and it's because over the years we've added stuff to that application. And we're looking at it so often that we just don't see the obvious, you know? So if you ever say, well, why do you ask it this way in your application, or why do you do it this way? It's okay to ask stuff like that, because that may improve our application, our process next year. And so, don't ever feel like you can't ask a tough question. If I'm embarrassed, I'll just point at my elected officials, you know? And if it's kudos, if you want to give us praise, well then I'll really point at you. So, yes.
I'm glad to hear that, because I want to ask a question that I don't want to seem like I'm being difficult.
Go ahead, be
So
difficult.
I'm looking at 11 and wondering, how do you define patient? Because I'm seeing that you could be deemed ineligible if you're not providing direct patient care, but are we talking, when you say patient, are we talking about residents who may have healthcare needs, whether they're already attached to a service provider?
Yeah, well, it says may. Okay, it says may for a reason. It is because a few years ago, we're moving more in the direction of, I mean, there were a few years when we were getting close to $2.7, $2.8 million worth of requests, and we're providing $2.3 million worth of funding. And that's when we kind of changed the focus a little bit on direct patient care, okay? Does that mean we're only doing direct patient care? No. So it's kind of our way of saying, hey, if you're not, you may not be considered as high a priority as someone who is, all right? Does that kind of help? I don't know if it's fully gonna answer your question. But if we were looking at only having 100,000, let me give you a real clear example. If we had $100,000 left, and we had a $100,000 request from a community clinic, and we had a $100,000 request from those who wanted to, let me give you an extreme example, and I don't wanna peg anybody out, but sometimes we have trouble with these kind of things. Someone's saying, well, we're doing healthcare, we're providing exercise equipment at a nonprofit, recreation program. Okay, so what do you think the priority is gonna be? So that may be an extreme example, and remember, some of this, no matter what the grants policy says, some of it still comes down to objectivity on the part of the board of directors and what their personal views are of whether this is the kind of thing they'd fund or not. But, so all we're saying is, are you out if you're not providing direct patient care? No. But if we're deciding between those that are and those that aren't, it probably leans with those who are doing some kind of direct patient care. And community clinics are really obvious ones to me, but I mean, there's obviously, look at our grants list. It's on the website, right?
Oh, yeah,
Yeah.
which was, I guess I could just talk right through this mic. This is new, and it's something I should point out for those that may have not had a chance to visit our website. We've been revamping little pieces of it bit by bit for those of you that have checked out grossmonthealthcare.org, but of interest today would be that we have a grants resource page. So if you did want to delve a little bit more into the application or the budget, we did have a question last year from an attendee, could we spend more time on the budget? We do have those resources here, which would include our past recipients. Bear, if you want to do me a solid and just click the
I was gonna tell you to
last.
click on it, and then I
Yeah,
realized you're over there
sorry.
and I'm here, right?
So this is just a quick snapshot. It's certainly not an exhaustive list of all of the people we've funded since 1996, but it gives you a good sense of some of the variety of services that we've seen from clinics and community-based organizations. And so at least it's a starting point for you to see kind of who's been funded by us, whether it's been repeatedly or, just a couple of times. At the very least, just to get you started with an idea of who's in your network that you may not already work with naturally or sit at other tables with. We know it's certainly not everything that we could provide to you in order to, collaborate and work together, but we were hoping that at the very least it could be a starting point for some of the newer folks sitting here today to kind of get a sense of who we would fund.
And by the way, you maybe look at some of those names and you may not be familiar with them. If you've got questions of what do they do, so you can have a better sense of the things we fund, you can ask us that as well.
Yeah, we'll provide all kinds of stuff. I think, do you have a question?
Yeah, what's the average grant that you funded last year?
The average amount?
Yes.
Is that a safe, do we have an average? 30?
Well, I guess we'd have to figure the average, but I'm gonna put a guess on it. Outside of the benefit to the Sharp Grossmont Hospital through this state program, outside of that one, because that's $1 million, okay? The largest one is one you started.
Yes.
Back in the day, called Volunteers in Medicine, and that's $150,000, all right? And the community clinics oftentimes get, depending on what they're doing, maybe 50 to 70,000. Okay, a lot of these other organizations, are probably in the 25 to 50, some of them maybe even $10,000, $15,000. You know, I don't, it's hard for me to say what the average is, but, you know, maybe about 25, somewhere in there.
But we can exceed the 25K ask, it's just kind of a range that we have to think about.
Right.
Thank you.
Now, in the last couple years, sometimes when there's a one-time ask, such as a significant capital request. I mean, 2.5 years ago, we funded a new clinic for Mountain Health and Community Services out in Mountain Empire area, and that was for all their equipment needs for their new clinic out there, and that was $1 million. Okay, so that's a specialty thing in which the board of directors is feeling very, very motivated to provide services. There's a need, and that's outside of our grants policy. I mean, that 2.3, that doesn't like, hey, there's nothing left, folks, sorry. No, that's outside of that.
And most of
So,
you that have any
yeah.
sense of Campo can understand how
Yeah.
great that need must be.
So once in a while, I mean, for instance, when it's exceeded the 100 or 150 level, it's usually been for significant capital requests, remodels, new clinics, things like that, where they've come. And sometimes one of the community clinics, and the list is, probably all of them are on there, but Mountain Health and Community Services, Neighborhood Healthcare, Family Health Center, San Diego, La Maestra, those are just a few. You know, sometimes they come and they're doing a major remodel or a new facility, and they're asking us for significantly more. And sometimes it's even with the understanding that they're asking this year, and they're gonna take a year off before they ask us again. So there are exceptions. And by the way, Bob and Gloria, you know, has been on this board since the advent of this grants program. I mean, if you wanna pipe in on anything, feel free, you know. That would be considered technical expertise from the board of directors, not a meeting. Yes?
I have a question. So you've listed your 5 priorities. Is there a way to gather information or about those categories
Oh,
or additional
Erica's
information?
just was waiting for this one.
Great.
Well, there's no hard and fast answer on what you could put in your
Yeah.
application, but absolutely, there's a wealth of data.
Okay.
Just off the top of my head, I'm thinking of the community need index that's used by the hospital partners and the county and some other players to sort of outline. So for just an example, let's say you're one of the people in the room that's thinking, I've got a shot under one of these social determinant sort of priority need categories. There's a lot of data we can get you that's already been sort of parsed through to get to those 5 that you can certainly use. And we
So-
can get you those resources.
so
It's
what
all
if-
public.
Erica, what if someone looked at the needs assessments that we mentioned? Would that help? That would help them?
Absolutely,
Yeah.
absolutely.
And they're mentioned, and by the way, the main ones are mentioned in the policy, further up. And I mentioned Hospital Association, San Diego, Imperial Counties, County of San Diego, and Sharp Healthcare.
This process is maybe not as old as the Grossmont Healthcare District, but it's been going for a while, so we feel confident about it, about the data, and we think you will too, once you kind of take a look.
Have you ever funded a capital project for a non-healthcare organization or that wasn't specific to healthcare?
Not specific, no, not that I can think of. I doubt it.
Okay.
Okay. By the way, since we're focused on capital, make sure you understand as well that, because we're a government agency, the law is that government funding must be used for construction in a prevailing wage environment, okay? Sometimes organizations are coming and they're asking for a piece of their funding, right? And they're doing their construction not prevailing wage, all right? And the problem with that is once we combine our money with their other monies, they just don't meet the test and they don't wanna do it that way. So oftentimes, that's why organizations will ask us for equipment instead of construction. Because when it comes to equipment purchases, there's no labor involved, so it's, you know, other than the specialty technicians that do the equipment installation, but the purchase of the equipment itself, there's no labor involved, so that's the reason for that. So keep that in mind if you're thinking about a capital request. Yes,
I'm looking at guideline number 8, specifically.
I have it memorized.
Okay. Specifically the part about meeting the needs of the otherwise underserved. And I'm wondering if Grossmont Healthcare District has any, like, any specific way that they define underserved communities?
Erica's been waiting for this question.
Oh, good.
Haven't you?
He's funny. Yes, so again, I would refer back to the needs assessment and some of the data. Like, so for instance, if you're kind of looking to put an operative definition to underserved, there's the community need index, there's the Health Resource Service Administration definitions, but we like that we don't have to go to the federal level because we have the local data, which, you know, they parse through all that. So again, I would just refer back to the tools that are used to sort of make the points in the needs assessment. We
And
can
you,
get those
and the federal one you did mention.
The
Say it
HRSA,
again?
Health Resource Service Administration, they have, you know, pretty well-defined shortage areas. And then they take it a step further to the populations themselves, so they kind of look at where workforce shortages are and where the community need is. So there's just really, I mean, a number of ways that you could look at this and frame this in your application. But I mean, probably, and for those of you that are just like seasoned in applying for grants, then, you know, correct me if I'm wrong, but I feel like everything kind of trickles down, you know, to some degree from federal standards. And then it works its way, you know, into what works for your jurisdiction. So for us, you know, we do trust our partners at the county and at Sharp Healthcare, when they say this is how we've defined need.
And I heard you're making a lot of emphasis in organizations who work on the east part of San Diego.
Correct.
If we are representing an organization that we kind of cover different areas in San Diego, including the east, is that your thing?
Oh yeah, that's fine, and I think, right, like as long as you can demonstrate in your application that there is a population in our region that you're serving. I mean, you know, we've funded Alzheimer's San Diego, they're not just for East. Champions for Health is here, they serve everybody. But their programs, you know, can identify that there's a specific portion of people in our community they're serving.
So either, organizations that provide services in more than the East region, and obviously there's a lot of them, they're either proposing a program in the East region, okay, specific to the East region, or they're able to tell us, hey, here's who we're serving countywide, but of those, here's the populations we're serving in these particular zip codes, and that amounts to blah, you know, so on and so forth. So, I mean, they run their data in that way. Does that make sense? Don't be shy. Gloria.
I want to add something. So over 20 years, there is something that continually comes up every once in a while, like almost every year. Starting new programs, if you want to hire somebody, just keep in mind that it is the district is not an employer. So if you have in mind to hire somebody for your organization, you need to make sure that you can fund that person later. You know, we look at it sometimes if there's a challenge and there's really a need for it and it's an outstanding program, it's gotta be really outstanding. The district will help you get started. That's seed money, and that's all it is. But in the past, many years in the past, we had people come back and crying that if they didn't get money to keep that employed, they would just have to fold. So that's when we got onto the collaboration beginnings. So
Yeah, we've
just
been,
keep
and
that in mind.
yes, and Gloria, having served on the grants committee probably more than any other member of the board of directors over the years, knows full well that sometimes the committee and the board is very hesitant when they see a new program in which it's employee laden, and then they're saying, okay, well, I mean, we know we're gonna be the bad guys. We're gonna be the bad guys in a couple years when we have to say, well, wait, no, we got you started, but it wasn't to create something in perpetuity. And you can understand why there would be hesitancy there. So, those that have done this successfully are able to provide a new program to us, and also identify that within, 1 or 2 years, they expect that to be self-sufficient, through other reimbursements or other grant programs, or combined, without being reliant on us. Is that right, Gloria?
Yeah.
Yes. Anybody? Don't be shy. Anybody else wanna be difficult? Yeah.
So, have you experienced with some of your organizations, redistricting of branches, redistricting of funding, where a group that was one entity has now split, and so they have a history of getting a certain amount, but now they have individual operating budgets, so they're within the same organization, but with independent programs?
Only the YMCA. No, I'm kidding. No,
You know, just to throw a non-specific answer.
No. Well, okay, I'm not sure if this addresses, we've had organizations that have changed. Alzheimer's San Diego is an example. Alzheimer's, it used to be the Alzheimer's Association of San Diego County. And, yes, louder?
I was saying if it was hot in here.
Oh, okay. I thought you were telling me to go up, okay. So it used to be Alzheimer's Association of San Diego County, and, apparently there was a disagreement with the national, and this was about 3 years ago, there was a disagreement with the national organization, and therefore they decided to split off from the national organization and become Alzheimer's San Diego. There is still an Alzheimer's Association in San Diego County that is active, that is controlled by the national organization. Our history was with the leadership and the folks that had been with Alzheimer's Association of San Diego County and is now Alzheimer's San Diego. We have not had a request from Alzheimer's Association since this took place. But we're very active with Alzheimer's San Diego, and in fact, we're doing an Alzheimer's response team pilot program here in East County with them through the county of San Diego. And that's about trying to keep folks with Alzheimer's and dementia in their homes to the extent possible. But I don't want to get too in the weeds on that. But that was a special grant. I mentioned a special grant. That was $300,000 a couple of years ago. We're in the midst of that. So that's an example I can think of, but I'm not sure if that's what you're asking.
To go more specific, since
Yeah.
we're talking about the YMCA.
Oh, okay, it is the YMCA. I saw her name tag, but.
If we have, programs that used to operate financially together, so it would have been a much larger operating budget, and now we have 3 separate, smaller operating budgets that are running independent programs from each other. This is a hypothetical example.
Right.
Let's say one is running a diabetes program, one is running a cancer program, and one is running a behavioral health. Would we start to submit 3 separate, smaller applications?
So McGrath, Davis, and Cameron would have to decide what their priority is and ask us for one.
Understood.
Does that answer it?
It understands
Okay, thank you.
perfectly and specifically.
Okay,
Thank you.
great. Anybody else? And by the way, we had to get into that. This is really funny you brought that up that way, and I didn't know this was going on, but it used to be for the high schools and even the college district. We get a request from the administration of the Grosse Pointe Union High School District, and then one of the schools was coming and asking us for something, and it was a real need, and it was a healthcare need that they may have. Or Grosse Pointe College was asking us for something, and Queen Mecca College was asking us for something. And when we're looking at funding limitations, so we had to say, look, prioritize your needs through the central office and ask us for that. Don't come asking us separately and then make us figure out what we want to prioritize. So,
Great.
okay? So that's the philosophy.
Awesome.
Okay? Steve?
Yeah, for the sponsorship of the
Does it have to? No. I can tell you Gloria is one who likes it to be in East County. So, I mean, Gloria, would you say it's an absolute no?
No.
No, I would say what I said before, identify how it's going to benefit those in the East region. And understanding it may take some of the, glow off your request if it isn't an East County one. But I understand, you know, the larger organizations have walks and they have things, and we get that, with the Heart Walk, whatever, you know, things like that. I mean, they're not probably happening in East County, we understand that. Just tie it to East County for us.
How do you look at the opportunities for larger projects? Is that a separate conversation?
There's no set way we start that. I think if someone were coming to us and, well, here's what I say. If you had something that you're interested in and it was a larger project, and this, by the way, this offer is always open. First of all, call me, okay? Because oftentimes what I will say is, look, and maybe this is a smaller project too, but it's a new one and I just don't have a sense. Instead of you having to spend the time putting together a grant application, then I'd say, put it in a letter to us so we can kind of understand what it is you're thinking about. I can take it to the grants committee. It's not the entire board. The grants committee can at least give some feedback. Just to tell you, you know, our sense sitting here on the committee is, that's funny. No, or don't waste your time. Or, yeah, you know what? Go ahead and submit an application for that. It's still not a commitment, but it saves the applicant some time in having to fill a big application. So if it were a significant, especially a significant dollar request, it could go the same way. You could call me, I could give you some guidance on whether you want to send a letter. We take it to the committee, and the committee, you know, would say, hey, it's $2.4 million. So they could say, wow, that's like that Mountain Health one a couple years ago, a brand new clinic in Campo, you know? But you remember, this also has to balance against what available funding we may have outside of our grants program as well, so.
Did I hear correctly that you value, measuring outcomes of programs, and if that's true, does that help the,
Yes.
the
Yes,
quality
yes.
of the application?
Yes, yes, and yes. Right.
Anything that you wanna send us is gonna help. I think we had some feedback or a question about that last year. Do you want pictures? Send us whatever you think shows the impact.
You know, I mean, and I would say, of course, pictures are nice, but I mean, if it's data, which is showing, you know, how you're going to address the underserved population from a healthcare standpoint in the East region, and you can provide some data in that regard, that's probably a little bit more significant than pictures.
That's true.
By the way, Michael Emerson, our third board member, we've got they can take a vote right now. There's really, Michael Emerson, Michael is past board president as well. All three of these folks have been board presidents. And Michael has been on the grants committee a couple times, right?
Yeah, I've chaired it a couple times, and I wrote the collaboration parts of it, so if you have any problems with that, you carried it in there, so you can shoot me.
Yeah, that collaboration part, that's all his fault.
Yeah.
So, okay, anything else? Yes, sir.
The 500,000, Barry, by no means is a ceiling, correct? In other words, that the remaining 702,000, if there were.
Oh, absolutely.
Yeah, so.
Good question.
Yeah, yeah. If the whole, if the whole 1 point whatever it is came to address those prioritized needs, we'd be all over it.
Right.
We're just trying to break out a certain amount that we're saying, hey, we're doing this. Okay, but yeah, there's no ceiling.
Thank you.
Who else?
I have one more question. So when with the priorities, is there any set priorities based on, like, let's just say behavioral health or the mental health? Is there a target, like adult mental health, behavioral health, children, or is that open for
Well, I'd say it's open,
Okay.
unless Erica's gonna say, well, no, the needs assessment says it's.
So we had a lot of conversations about that in our grants committee, you know, how specific do we get? And I mean, the fact is, like, the need in all of those areas sort of span across all the age groups. So, yeah.
I mean, if you,
Thank you for-
yeah, and that's why, by the way, I mean, when you go to the, you saw, we just mentioned the 5 prioritized needs, and we decided not to get more specific on them for the very reason that this is the first year we're doing this, and we didn't wanna tie it down. We may have shot ourselves in the foot, you know, on this, because of the response we get, we don't know, and then we'll refine it next year. But we wanted to leave it open-ended as much as possible. But to the extent you're looking at those needs assessments and seeing anything that's more specific for one of those categories that you're trying to address, and it's in the needs assessment, by all means. On that one, yeah, I don't think the needs assessments separate between adult and childhood and mom.
Barry, can I add on that? That's, when I was speaking about that collaboration part, when you have, let's see, I have to be careful here. There's a hierarchy of money, that's how I look at it, in the district. And the county has a lot of responsibility on the mental health part. So we would look at, if your application came to me and I was on a committee, which I'm not, but I would look at that and see how you're collaborating with the county to make sure there's not overlap. That's another thing about how we want our money to be strong with the project that it's working on, not to lose it to other. So I would look at that first too.
Just as an FQA statement.
That's just a clever way of saying you're not getting the money, if the district, if the county's gonna pay up, which they should, if it's a project.
Call it like it is.
What's the proportion of, what's the acceptance rate? What proportion of, applications do you award?
Another really good question.
That's a good question. I mean, I can always give you the dollar amount that we got last year and what dollar amount we, turned down. Can't do it right now. I mean, I could tell you, you know, it's significantly high. And the reason it's significantly high is because folks that believe they probably qualify based on our policy are the ones that are asking. You know, we're not getting a lot of applications from people that don't even get there. This is, I mean, in fact, this is the first year we're actually putting our grant application online. But there's a disqualifier there, or a qualifier. It's either a qualifier or a disqualifier, depending on how you look at it.
I can come back and drive.
Okay. The reason we've never put it online, because we were afraid, anybody, even someone in another state is gonna come across it and like, you know, and submit an application to us, and we're gonna, and of course, right? So spend some time to call me and ask first, and so on and so forth. We've put it online, but we decided to put a little statement there, which is basically saying, if you're new and you're not contacting us to see if you even qualify, or this is at your risk, okay? But my point is, we've saved time for those who probably just aren't gonna be there. So those that are asking probably are in the realm of a good potential. So it's higher than you think. But if you want me to give you the actual numbers, I can.
And I will put this guy on the spot and say that he will, talk to you. I mean, we're not a huge ivory tower where you've gotta find the right department. You know, he'll answer your questions to the extent that he can.
So, quick question.
Really? Oh, yeah. I will.
Is that wrong?
No, that's right. John?
Okay, so, if we ask for, say, 50,000, and, the brilliant people on this committee that are making these decisions, that are full of compassion in their heart, realize they're running out of money, but would they come back to the group and say, hey, could you do it for 30,000? Is there any kind of flexibility on that?
We do that all the time.
All the time.
All the time. And a lot of times somebody will want, you know, say 27,000, and after we things out, we may only offer them 18 or 19. On the other hand, there may be a project that's absolutely outstanding, one that you know. And, we may feel that it's worthy of maybe a little more. If, yeah, the money.
I could even think of some examples where an organization came to us, they've never asked before, they didn't touch base with us to even like get an idea of what's the average, as you asked, you know? And we get a $70,000 request, and we're kinda like, huh? You know, we'd never even heard from them before, but it's a really good program. And once we talk to them, it's really good, but we got, you know, so the committee has even done things like saying, well, let's go with 20, but ask them if that means they're going to still do it or not. Okay? Right? And some have said, I can't, because I was relying on your funding to get this new program going, I couldn't possibly do that. Others say, oh yeah, well, you know, well, we'll take your 20 and we'll find a way to do it. I mean, I can think of one in the last couple of years where they're proposing something really, really good. It was for a certain number of specialists, and because we were out of money, we said, would you do it and get this going if you could only hire the one specialist? And they said yes. So sometimes it can be even way less, especially, by the way, especially on charitable request sponsorship. I mean, folks often come and say, well, you know, we want you to be the grand platinum golden Yahoo sponsor of $25,000, and we're not gonna give more than $2,500 or $3,000 or $5,000. Do they not take that when it's a they usually take it.
And let me ask something. Please remember that, you know, sometimes in the beginning, the two committee members, bless their hearts, they have to read all of that. So you don't have to spend 15 pages telling the board members what you want. Condense it, make sure you hit all the right points, the people you're gonna get, but please, you don't be redundant with every page says the same thing over and over.
One page.
Well, not just one page.
Elevator
You know,
pitch.
get the meat of it in there, but don't bore them to death, because remember, if you think that there's 40 and you wanna compete with short and concise, is what you wanna do.
Yeah, the cover page, I mean, we know the cover page isn't the entire application, we understand that. But sometimes it's a little surprising that this most significant thing they're doing healthcare related is not really mentioned on the cover page. So therefore, we're kind of missing the fact, oh, well, what you're really saying is this, and it was on page 6, you know. So, so focus a little bit on, make sure your cover page is addressing the main thing you're doing in the full application. And that's not to say anyone isn't really reading your entire application. It's just that it's an executive summary for us, right off the bat, right?
For the 5 priority needs areas, are those in ordinal fashion? Like, are those in order of the priority that you care about,
No.
or they're just listed in a number of fashion?
We could have put bullet points, I guess.
I wanted to make sure to ask.
It doesn't mean one is more
The
important
most
than three.
important, okay.
I think that's the priority they came up, in the needs assessment, right? Yeah.
I don't know that they're even in ordinal, they might be, I could be speaking incorrectly, that they might be in ordinal importance in the needs assessment, but I'm fairly sure that our community benefit friend over at Sharp Healthcare who comes and presents the report to our board was actually articulating that last month. It's not ordinal for them either.
Is the board open to opportunities for like new agencies? Cause I know sometimes boards don't know the agencies if they're brand new. Are they open
Yes.
to have a new organization come in and do presentations or get to know me type of opportunities, a new agency and you don't know me, I don't know you, and
Sure.
Is there
That-
those
well,
kinds of
okay, the way it typically works is we would have an application, or we'd have a letter, as I mentioned, and our curiosity has been piqued by what looks like a good program, but we don't know the organization, so we ask some questions, and then we invite you to the grants committee, so the grants committee can see. And you remember, you know, the applicant, I mean, who here has done an application? Okay, so a little over 50% it looks like. I mean, you understand that we're asking for financials, and we're asking for audited financials, and we're looking at things like that, which sometimes speak to whether the organization is new and they don't really have anything to show, or whether they, so new for us could be a long-established organization that's never asked for any money. And they've got really strong financials, and that's clear, all right? A new organization may have a little bit more difficulty with that, but, I mean, we know what the nonprofit law is on on how much money you've got to have before you even have to do an audit. So we're asking sometimes for reviewed financial statements and things like that. If you've got questions, the application even says if you can't meet the criteria on a reviewed financial statement, that's not an audit, but a reviewed financial statement, and you're trying to get there, that you can even talk to us about whether you include money for that in your grant request, so we can get you there. All right? And it says that.
Yeah, I didn't mean it that,
I'm just expanding on what you asked, because I thought.
You mean if you wanna do a meet and greet in general, and you wanna just come for public comment during our board meeting?
exactly is what.
Oh, sure, okay.
Then just
Okay.
bright and early, 7:30 on Fridays, every third Friday.
So let me.
That's kind of what.
Yeah, well, no, you can do that. I mean, any of the meetings, you can come and introduce yourself. Yeah, absolutely. Some folks have asked, because they've been new, the grants committee has said no. You know, I always call folks and let them know, here's the recommendation, here's when you can come address the board. Sometimes they come and they say they try to change the board's mind. Sometimes they come and they say, we understand you said no, here's what my organization's about. Here's why I think you've missed the mark. They don't usually say it that way. But I mean, here's what maybe you didn't understand about my organization. Okay, I can think of someone who came here 6 years in a row and got turned down every single year. Okay, and just was nice, was professional, and always jokingly said, one of these days we're gonna get there. And this last year, he got there, all right? So, that maybe, by that time, maybe some organizations have gone away, but, but he did successfully, so.
Thank you.
Anybody? Okay.
Thank you.
So we'll send out a link, ask you for your thoughts, and we'll post a video if maybe you have any colleagues or friends that might want to know what happened today.
And if you have individual questions you were embarrassed to ask publicly, you're out of luck.